The innovative part of what we're wanting to do is to take these tools and apply them to mental health with the goal of actually developing computer simulation models where we can then ask a whole series of what-if questions. What if we added more beds here? What would be the impact of that on the use of the hospital? Would communities respond in the appropriate way? And so that we could test these policy choices and actually try to figure out what it would cost to do X as opposed to Y, and what effect might that have on sort of right-sizing or getting the optimum use of these facilities in community programs. So that's what we're intending to do. These are basically decision tools from a management perspective to help policymakers, help legislators, help people at the state level, as well as the local level, to sort of understand what are the likely consequences if we adopt these policies, and to sort of test the policies in the environment of a computer simulation rather than doing it in the real world, where it takes a while to know what's going to happen. And if you look back on reform here in North Carolina for the past several years, it almost is we try a bunch of things hoping that they're going to work, and it takes us a couple of years and hundreds of millions of dollars to figure out they're not quite working the way we want them to. Well, a lot of that could have been anticipated if we had these kinds of tools that we could sort of use ahead of time to really look at the policy consequences and costs, and what are the kind of unexpected things that would be revealed by that no one had quite thought of, and suggest ways that a more refined, more fine-tuned policy could be more effective. So this is just a very simple example of what a computer simulation model might look like. What the model tries to do is to look at the queuing of patients waiting to enter the hospital, and then based upon length of stay of different age groups and diagnostic groups in the hospital, the people waiting to be discharged. And we're hoping that through this we can train a lot of managers, both at the state and at the local levels, how to use these tools to sort of think about it, so that there would be kind of a training component associated with this as well.